How have you been?
Oh, I've been pretty good, just studying a lot for school and trying to get everything done with my homework. What about you?
Same here.
Oh my God!
Are you okay?
My back, it really hurts, my lower back.
So what brings you in today?
Well, lately, every time I try to void, it really burns and it's kind of painful and I feel like I have to pee and then I can't pee and yesterday I actually had some really sharp pains in my lower back, kind of on the sides of my back, and I've just been feeling really run down lately and pretty nauseated and come to think of it, I actually threw up last night too.
Oh, okay. Have you ever been diagnosed with a kidney infection in the past?
Nope, I've never been told I have kidney problems.
Okay. Well, it sounds like your symptoms could be acute pyelonephritis, which is a kidney infection.
Statistically speaking, acute pyelonephritis occurs primarily in young women. Women are 5 times more likely than men to be hospitalized for acute pyelonephritis.
So, how could I get kidney infections?
Well, there are a few causes for kidney infection. Kidney stones, or any obstruction in the urinary tract, which doesn't allow the bladder to completely empty itself. Any leftover urine will allow bacteria to grow, and that infection can travel up to the kidneys. Have you recently been diagnosed with a UTI?
Yeah, actually my doctor gave me antibiotics a little while ago.
Okay, so sometimes when the antibiotics don't work or not taken properly, that can lead to a kidney infection.
Here's a fun fact. In 2005, a study reported an incident rate of 28 cases of acute pyelonephritis per 10,000 women aged 18 to 49 in the United States.
So now I'm going to need to collect a urine sample from you and run some tests. The doctor will be in shortly to perform a pelvic exam to rule out any other possibilities.
Okay.
20 minutes later.
Your urine analysis and the culture showed bacteria, high white blood cell count, protein, and trace amounts of blood, which confirmed a kidney infection.
Most often, gram-negative bacteria, commonly E. coli, is responsible for causing pyelonephritis.
Oh my God, am I gonna die?
No, for mild cases like yours, we will prescribe a 2-week antibiotic therapy.
In more severe cases, however, hospitalization and IV antibiotic therapy is necessary.
So, how can I avoid getting this in the future?
Be sure to drink a lot of water, about 8 glasses of water per day. Anytime you feel like you have to urinate, use the restroom. Don't hold anything in. Make sure you urinate after intercourse and use good hygiene.
Did you know, in the United States, acute pyelonephritis accounts for at least 250,000 office visits and 200,000 hospitalizations per year. While pyelonephritis is more prevalent among women, mortality rate is actually higher for men.
Is she always here doing that?
She's our student nurse.